Do we have any research, any links people can look up?
I'm working on it. So I will be writing the best thing I can to approach a relatively comprehensive massage therapist's introduction to long COVID.
Yeah.
Probably a little later in the fall.
I can see us having a large portion of I can see massage being very beneficial.
Huge, because there's so much, what we know so far is that the people who appear to have this have lots and lots of symptoms of, do you call it chronic fatigue syndrome or myalgic encephalomyelopathy?
Yeah,
ME or CFS. Yeah, and CFS is, at least for some people, a post-viral syndrome. And a lot of the things that we're seeing with some people with long COVID and some people with CFS, with chronic fatigue, have big overlap. And there aren't very many things the medical community can do for those folks, but they love them some massage.
Yeah.
But one of the reasons I've been delaying writing much about long COVID, I was getting closer and closer, and then Delta hit, and that was, and now all our hair is on fire about acute cases. And we're, the chronic, the long-term cases are getting less attention. But one of the real challenges about trying to even say complete sentences about long COVID is there's no agreement about what it is. There's not a diagnostic criterion. There's not any consistent guesstimate at what percentage of people who had COVID develop long COVID. We know that it appears to develop in people who had both mild infections and severe infections, but the people with the really severe, hospitalized, maybe on a ventilator for a while, those kinds of infections are, not surprisingly, at much higher risk for permanent organ damage, lung damage, heart damage, liver damage. But we have seen heart damage in people who had really, really mild cases as well. And, so until we have some kind of agreement on what it is, it's going to be hard to say much about it. I have begun reading some of the theories about contributors to it, because there's the post-viral syndrome camp, and there's the, we're still harboring colonies of virus camp, and there's the, we have stimulated an autoimmune reaction camp, and there's it's low-grade central nervous system inflammation. It's, there are, and it's probably a combination of those things, but I counted about 10 different, quite complex theories about what's going into long COVID. And so when I get ready to write something for massage therapists, let's just say I'm not really looking forward to it that much. But I mean, people are hungry to be able to be helpful. And once we get over the hair on fire Delta thing, and people are re-gearing to think about getting back to work and being able to work with more people. If massage therapists just want to help. They really, really do. And the way we can work with breath work and anxiety, and both of those things are exacerbated by this infection. I just think our work, even just a matter of helping people breathe more easily, is going to be so impactful.